alleviated by different treatment modalities, such as pain medication, injection, surgery, or alternative therapies. Alternative therapies may include the following modalities: physical therapy, chiropractic, electric nerve stimulation, laser therapy, acupuncture, massage, and stress reduction meditation. Treatment of pain. The principle of pain treatment can be divided into three target areas. They are peripheral nerve receptors, spinal cord, and the brain, where the pain excitatory receptors or pain inhibitory receptors can be modulated by drugs or psychological technique. Pain medication can be categorized by the following types: non-steroidal anti-inflammatory drugs, COX-2 inhibitor, opioid analgesic, antidepressant, anticonvulsant, anxiolytic, muscle relaxant, and corticosteroid. Each type of pain medication is targeted to specific receptors to alter the pain response in the nervous system. Non-steroidal anti-inflammatory drugs work by blocking pro-inflammatory prostaglandins synthesis in the peripheral nerves that can cause inflammation, pain, and fever, as opposed to opioids, which affect the central nervous system. Non-steroidal anti-inflammatory drugs represent one of the most widely used classes of therapeutic agents, but their tendency to cause ulceration and bleeding in the gastrointestinal tract is a major problem. Opioid analgesics such as morphine and codeine decreases the perception of pain by blocking the pain receptor or by binding to opioid receptors in the central nervous system. Muscle relaxants reduce pain from tense muscle groups, most likely through sedative action in the central nervous system. Most muscle relaxants, antispasmodic agents such as Soma, Flexeril, have side effects of sedation, drowsiness, and may cause dependence with long-term use. Diazepam is used for muscle spasm, anxiety, and alcohol withdrawal symptoms. Most muscle relaxants, antispasmodic agents such as Soma, Flexeril, have side effects of sedation, drowsiness, and may cause dependence with long-term use. Diazepam is used for muscle spasm, anxiety, and alcohol withdrawal symptoms. Side effects of long-term use of pain medication may include nausea, vomiting, renal failure, liver damage, blood clot, constipation, dizziness, drowsiness, headache, stomach bleeding, muscle weakness, and addiction with narcotic drugs. The therapeutic effects of pain medication can be summarized as reducing inflammation, blocking the perception of pain, sedating the central nervous system, and relaxing muscles. Pain medications do not resolve the cause of the pain. It is made to suppress the feeling of pain. Pain management plan should support to restore tissue damage and organ functions, as well as psychological health for the mental and emotional stress. Adding nutritional supplements such as amino acids, B vitamins, and antioxidants are a good strategy for the long-term pain management plan. These are elementary ingredients for the tissue regeneration and the optimum function of the nervous system. Amino acids. Amino acids are critical to life as building blocks of proteins and have many functions in metabolism. Besides making proteins, amino acids also perform critical biological roles such as synthesis of neurotransmitters. Glutamate and GABA are respectively the brain's main excitatory and inhibitory neurotransmitters. B vitamins play important roles in cell metabolism, support and increase the rate of metabolism, enhance immune and nervous system function, and help maintain healthy skin, hair, and muscle tone. Antioxidant glutathione. It is the major endogenous antioxidant produced by the cells, participating directly in the neutralization of free radicals and reactive oxygen compounds, as well as maintaining exogenous antioxidants such as vitamin C and E. It is used in metabolic and biochemical reactions such as DNA synthesis and repair, protein synthesis, prostaglandin synthesis, amino acid transport, and enzyme activation. Thus, every system in the body can be affected by the state of glutathione, especially the immune system and nervous system. Acupuncture and pain treatment. As a complementary medical procedure, acupuncture has a significant impact on the treatment of acute and chronic pain, though the physiological mechanism behind this method are still unclear. Pain alleviating effects of acupuncture may have been attributed to the activation of pain inhibiting systems. Pain inhibitory pathways in the central nervous system can be activated, or pain excitatory pathway can be deactivated by needle insertion in the acupuncture points. Ear acupuncture, auricular therapy, is based on the theory that the human anatomy can be represented in the auricle of an ear, and stimulation of the corresponding reflex area in the ear can achieve therapeutic effects to alleviate pain and restore functional disorders. Since there is no one standard ear chart, it is up to practitioners' discretion how to choose the most effective points for treatment in accordance with the different systems of ear chart. For this presentation, the most commonly used and generally accepted ear acupuncture points for the treatment of pain are selected from the Chinese, French, German, and US ear acupuncture systems. Ear points to treat pain. Based on the theory of pain modulation, we can select ear acupuncture points to treat pain from different categories, such as musculoskeletal points, psychotropic points, spinal cord, brainstem, anti-inflammation points, and muscle relaxation points. Musculoskeletal and organ system ear chart. Most often, anatomically corresponding points in the ear of a problem area of the body can be detected by an electronic point finder. The electrical resistance of the pathogenic point is less than the surrounding area, which can be detected by an electronic device. Also, a patient can feel a sharp soreness when the pathogenic point is pressed with a manual point probe. Musculoskeletal and organ system ear chart serves as a reference guide to find the reflex points to treat functional disorders and pain. Psychotropic points. Emotional and psychological factors take a considerable effect to how a person experiences the degree of pain. Stimulation of psychotropic points can result in affecting the brain to alter the mood and the perception of pain. commonly used psychotropic